On today's All Things Heart, today is Rural Health Awareness Day, and we're talking about the CARE Collaborative. It helps doctors across Kansas bring state-of-the-art care to patients across Kansas, no matter where they live. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Sometimes people living in smaller communities have to drive for hours to access specialized medical care. The CARE Collaborative was created to change that. It first focused on patients with heart disease and stroke in rural Kansas. That was back in 2014. Since then, past 11 years, it's expanded to provide training and treatments for stroke, heart attack, sepsis, COVID, heart failure, and diabetes, making specialized care more accessible to people who may live hundreds of miles away from the specialists they need. More than 2/3 of the healthcare organizations across Kansas are part of the CARE Collaborative. Vern Becker says it saved his life.
Going outside.
Since we're going outside.
Married for 55 years, Vern and Margaret Becker are partners in everything. They're best friends who often finish or echo each other's sentences.
There's the dog.
There's the dogs. So. Cataract a year ago.
They're also partners in Vern's health journey, which is why they love showing off how his old belts fit him now.
I don't have any more holes. I need to poke more holes.
They attribute his weight loss to Vern joining the CARE Collaborative in 2020. He'd already had heart surgery and was struggling to keep his diabetes under control.
Our doctor, because she knew his blood sugar was kind of out of control at the time, and she says, I think you'll benefit from this.
I'm a firm believer in keeping track.
The CARE Collaborative inspired Vern to keep meticulous daily records of his blood pressure, glucose levels, and weight. Also, every gadget in the home that Vern uses, from the bathroom scale to his blood pressure cuff and glucose monitor, is connected via Bluetooth to nurses at the University of Kansas Health System in Kansas City, a 4-hour drive from Hayes. Those nurses call Vern every morning at 8 a.m. when they get the results.
Nice calls from Janine, near CARE Collaborative. She goes, now what are you doing to correct that? And
have you had any breakfast?
They don't replace Vern's regular visits to his doctors in Hayes, rather enable his care team in Hayes to collaborate with other experts at the health system in Kansas City. That collaboration was incredibly valuable in 2023 when Vern had a stroke.
Left occipital
Explosive
stroke. It came off his artificial valve, and when it went up, then it kind of exploded.
They called Kansas City.
Yeah, they called, because we don't have a neurologist here.
The couple says the health system's neurology team worked remotely with Vern's doctors and nurses at the hospital in Hayes to come up with the best treatment plan.
Between the doctors at CARE Collaborative and the doctors here, they had it figured out which way they could go. 1.5
years later, Vern feels great, and he hopes to resume his hobby of making keep-safe trunks soon.
I want to finish up my trunks.
He builds trunks.
For young ladies.
Or whoever.
No matter what the future holds, Vern and Margaret are so grateful for the CARE Collaborative and plan to be by each other's side every step of the way. We are so thrilled to have Vern and Margaret joining us. And speaking of technology, we're relying on some of that today to bring you this very program. We have Vern and Margaret joining us virtually from their home in Hayes. We have Janae Dinkle, a nurse and health coach who treats Vern and joins us virtually, along with Dr. Robert Mosier. Dr. Mosier is the medical director of the CARE Collaborative. Vern, first off, how do I get one of those trunks?
Yeah, you're in line.
Are you back to working on your trunks?
I've been working on the trunks, and I've had another project I'm trying to get finished up, so I'll get there. Very
nice. Vern, you've really been through it, and Margaret, so have you as his partner. Vern, you had diabetes, surgeries, a stroke, now you're in recovery. How are you feeling today physically?
I feel real good. I actually feel like I came back pretty hard and strong. I didn't want to put anything to the side. I just wanted to keep going.
We love hearing that you're back strong and that you're on to new projects. Margaret, you've been through by Vern for now 55 years. Real quick, how did you guys meet? How did you get together? You told me a little bit about that back in high school.
Yes, we were in high school. He was a friend of my brother's. His brothers didn't like who he was dating at the time, and I just kind of walked by and they said, "I dare you to ask Alan's sister out on a date." And the rest is history.
Those brothers were very smart, very smart.
Yeah.
Vern, I love all the gadgets that you check. So what have you checked today? What are all the gadgets in your home that you've checked this morning or that you will use to check your health?
I have been through everything this morning. I've done my full notebook. I keep a notebook of everything I do. I have a spiral notebook, but once I get this thing full, I slide them over to a file. Not that I forget them, but we fall back on the notebook. I was looking for a page for this. Oh,
okay.
All right. I don't know if this will show up, but mine is in red. I do everything in red because since my stroke, I can do the writing in red, and I can see my numbers in red. But when they're in blue and black, I don't get to see them. I do my blood pressure every day. That's I have my blood pressure cuff, and nice thing about this unit compared to the one I did have, it goes straight to them, and Dr. Sandoval, my primary doctor, gets a copy of the readings just as fast, I think, as everybody else does. And then I do. Go ahead.
Well, I wanted to bring Janae in, your nurse, because this technology allows her to see what you're up to in real time. Janae, you were smiling throughout that whole story about Vern and Margaret, and you broke into a bigger smile when he busted out his notebook. What kind of patient is Vern?
He is an awesome patient. He's one of the many that he is on top of everything. I mean, he has his numbers every day, and he's like, if you call him with something's abnormal, he's like, oh, I know, I already did this and this. So he's always on top of things. He's wonderful.
That's amazing. So Janae, how often are you calling patients on a daily basis? How many patients through the Care Collaborative are you checking in with and monitoring the numbers from?
So really, there's not like an exact number of patients that I phone each day, as it does vary. I work both as a remote patient monitoring nurse and as a chronic care management nurse. And so as the remote patient monitor nurse, I monitor the abnormal vital signs that I'm alerted with, such as abnormal heart rate, blood pressure, blood sugars, or weight. And then I will phone the patient to assess how they're doing with the vital signs that were gotten. And this allows early intervention if needed to prevent complications. And then on the flip side, as the chronic care management nurse, I perform monthly care coordination calls. And in the conversation, we can update their care plans, assess any barriers that they may have to getting care, provide education, and then make sure that they're staying on track with taking their medications and keeping on top of their appointments. And then I also help patients manage long-term conditions while reducing hospitalizations and improve their quality of life.
Dr. Mosier, how have you seen this technology affect patient outcomes over the years?
It's been amazing to have this technology to be able to actually keep a little bit more real-time monitoring on patients and how they're doing, and be able to react to those in a more timely manner when we see, that they may be falling off of the curve as far as the blood sugars that we'd like to see them maintain the range in, or the blood pressure. So I think it's done a lot on helping with the monitoring to be much more timely, but I think it's also done a great job in connecting the team of providers and services around a patient, and actually just provide better care overall.
So they can have that collaboration that every patient that comes to the health system or uses a doctor in the health system can have, no matter where they live. This care collaborative began with go on.
No, I'm just going to say exactly. That's exactly what we're looking for.
At first, the care collaborative began with just heart and stroke patients. Why was it those areas first?
Well, we knew from looking at the Kansas data that rural Kansans had poorer outcomes, a higher mortality rate from heart attack and stroke than urban Kansans. And so we started with 13 counties in northwest Kansas and helped with implementing evidence-based guidelines into practice. And our partners were just great at changing out their protocols, developing the processes for more rapid identification of the heart attack or stroke patient, and then having the process and moving them on up to higher levels of care. So we went from seeing that higher mortality rate. We saw that less than 3% of patients with an ischemic stroke that were eligible for the clot-busting drug were getting it. And we've been able to see our partners improve that to where now over 20% of eligible patients with ischemic stroke are getting the clot buster. But overall, more timely management of these time-critical diagnoses, and with that, much better outcomes.
While you were speaking at the beginning of what you were saying, we showed a map to our viewers. If we can put that map up again, can you tell us, Dr. Mosier, is everything in blue? What is everything in blue show?
Everything in blue is one of our care collaborative partner. We map them out, by hospital and the county that they're within. And Jody and I, as we sit around and we see the map from time to time, we always continue to ask ourselves, what do we need to do to continue to fill in more blue counties to get more participation? We started with the 13 counties in 2014, and we're up to 79 counties now, over 91 different entities that participate in the care collaborative work. And I think even more impactful is if you look at, have we lost anybody since we started this work? And we have not. Everybody who's signed on to participate has stayed engaged. And actually, we don't charge anything to be part of the care collaborative. We just ask them to put in a little sweat equity to improve the quality of care. And of course, providers jump on that. That's something they're all about, is to provide good quality care.
Janae, that must feel remarkable to see a map like that, know that you are helping patients, any patient that's in the blue, you could be helping them. Everything in Vern and Margaret's home reports back to you, Janae. Have you ever had a patient who's reluctant to give away that much immediate access to their health and their scores? Because you can't hide anything when it's reporting right back to the nurse.
No, there are some hesitations because it does keep you more accountable. I mean, you have to, because if you do something, it's like, well, you can't really hide that you may have ate more one day, or maybe you did something different. It's going to show up. So, but when patients realize that their hesitation sometimes with the equipment, they're kind of intimidated, but when they realize that it's just like using a regular blood pressure cuff or a standard scale at home, they're more at ease and they're more open to using it. And when they do get the equipment, it is pretty much set up for them, ready to go. And then when they do use their vital signs, they're automatically transmitted and sent. We send them to their providers so that they can review it. So I think it puts them more at ease and know that people are on their side, kind of helping them keep on track with and helping them stay healthy. So it's wonderful.
Margaret, Vern had shared that when he had his stroke, it was his team of doctors in Hayes that were able to communicate immediately with doctors in Kansas City with the Care Collaborative, and that got him the specific help he needed right away. Who was the point person that you were getting updates from during that and then during his recovery? Besides Vern.
Well, when he had back surgery, and so he was in ICU recovering from the back surgery because his blood pressure had fallen, and they had gotten him up to start his physical therapy, they do right after surgery, and he had a stroke in the hospital, and so the doctor that was there then, Dr. Hemphill, was the doctor that he had I got my information from when he was in ICU. And then he went from ICU up to the cardiac care, and at cardiac care was Dr. Opondo. And so was the cardiac, the nurse or the doctor on the cardiac care unit that was there. And then when he went to the inpatient rehabilitation, it was Dr. Hemphill again.
So you had a whole team updating you, a whole team of people, which is what we like to hear.
Yes.
Dr. Mosier, what would have happened to Vern if he had had this scary stroke before the Care Collaborative existed?
Been on an airplane.
Yeah, well, that's a good question. In that it really depended on what was available with local resources, but I think it shows why the rate of use of the thrombolytics in a timely manner and timely movement of patients to more advanced levels of care were delayed because we didn't have the coordination and collaboration at the level that we have it currently. And there's obviously opportunities for continued improvement, but I think it's always having developed the evidence-based protocols for managing these patients and then acting on that information quickly and moving them on to the appropriate levels of care. And then all of the support that surrounds that, particularly in recovery, and once they return home. And that's where I think having our chronic care management, remote patient monitoring has been so great to continue to provide access and information to the patient, but also information that we're collecting that we can provide back to the patient's provider so that when they come in for the visit, they're pretty well, kind of informed and up to date as to how things have been moving along.
Janae, how do you build trust and connection with your patients when you're seeing many of them virtually?
I think with anything, building trust is something that is earned, and then having them understand that we value their privacy, and then it kind of allows them to have open communication and just knowing that I'm being reliable to them and reassuring them that I'm here to support them on their health journey. I'm also here to educate, guide, and assist them to meet their goals, and we are a team working together to help them stay healthy.
Margaret was saying when we went out to interview her that you've become like a family friend. Margaret, how strange was it to start this kind of healthcare? It's moving at such a warp speed. I mean, 10 years ago, I wouldn't have dreamed something like this would be available. What was it like for you? When things have changed so much since you first started going to the doctor.
Right, yeah. At the time, he had in 2015, he had open heart surgery. He had a valve replaced, and then about 5 years later, then I think is when we joined Care Collaborative. And I think Dr. Sandoval, our primary physician, saw that his numbers weren't doing what they needed to be doing. So we weren't doing something to help him. And she thought this would be helpful for us to get, have continuing information on how to treat it, what to do, when to do it, on a consistent manner than what, when you go to your doctor every 6 months, something on a more consistent manner. And then when we are also with longevity coaching there in KU, and Shelley, when she came on board, she sent him the physical therapy bands and more encouraging. She did Janae does kind of keeps track of all the numbers and what he's doing, and then Shelley is kind of more seems to be more on the well, what are you doing, physically? Are you walking? Are you exercising? And doing the bands and making sure you're staying active and just not sitting in your recliner. So with all that working together, it has been terrific, and it has helped. and I've seen such a tremendous amount of difference in what he's doing, and him being more aware of what he's doing, to help himself, like instead of eating changing his eating habits for one thing, and watching what he eats. So and it's up to him to what he has to do. I'm just a support person basically.
Well, Margaret, I think you're a lot more than just a support person. You are true partners, you and Vern. Yeah. Vern said he couldn't do this without you. And Vern, you're such a warm person. You're such a people person. Was it an adjustment to have to transition to a virtual relationship with some of the people on your care team?
It was. I had been around. My job had me talking on Zoom and everything else, so I was used to that part of it. But the part of taking numbers every day and getting everything recorded, I did not realize the far reaches of what I was doing in the mornings of taking my readings, everything. It was also helping Margaret plan our menu for the day and what we were going to eat and not eat. And there's just been so many things that have come from it that, we just, I don't know how I would have done it without it.
Well, when I would like to interject and say that when he was in the ICU and it was coming out of his, I guess coming out or becoming more aware after his stroke, he said, I've got to talk to Janae. He said, she's not expecting me to be gone this long. I've got to talk to Janae. I've got to let Shelley know that what's going on. They're not expecting this. This wasn't supposed to happen. And he was almost beside himself. So we have developed a really nice relationship with them, and how that they're having everybody in your pocket, and having your back. I think is part of the health journey. It's not something that you can do on your own. You've got to have these people behind you and supporting you and giving you kudos when you've done something right, or if you've done something that maybe you shouldn't have, that, they can say, well, why don't you try this differently? Why don't you do it this way instead? Something like that helps, because, we, as you said, we're out here and we don't have the specialized care immediately, otherwise it'd be a helicopter ride or a plane ride to Wichita or Kansas City,
or a 4-hour drive.
Or a 4-hour drive, yeah.
In the snow, which could happen anytime. We already have some great questions coming in. So if you, our viewers, have a question or a comment that you'd like us to read out loud on the program, you can send it to us right now on YouTube, Facebook, or the All Things Heart email. All the links on how you can connect with us in real time are right here on your screen. Vern, you have been doing the physical therapy that you talked about as the recovery from your stroke. Can you share your progress with us on how you are recovering physically from your stroke?
Well, one thing is I came out of the stroke having to have a cane wherever I went, and now I'm walking without the cane and walking, and I have a little eyesight problem, but other than that, I think all the physical therapy is the reason why I'm continuing to do so well with everything. I'm kind of one of these guys that expect you to do things. My favorite saying to other patients when they talk to me is, how many days a year do you see your doctor? And most of them will say 2. And I said, well, who's helping you the other 364 days? I just flat tell them, you gotta look out for yourself too. I said, and the doctor needs to know what you're doing. So I think with everything I'm doing, and I can't go to lunch at the hospital without one of the physical therapists catching me and saying something to me. So I know if I don't stay on my toes, the nurses are going to get me.
They're everywhere. The eyes are everywhere. So Vern, we should tell our audience, because you mentioned when you talk to patients, you spend a lot of time voluntarily at the hospital in Hayes as well. What do you do there?
I work in the heart of all areas. I work in the heart area, the DeBakey heart area, and I assist the patients to one, get to their rooms or to the offices that they need to get to. I assist anybody that's in a wheelchair and needs to move around in a wheelchair. So I'm staying pretty busy, and I understand they had a pot going as to see whether I would come back after having a stroke. And I said, well, somebody should have told me. I'd have got in on it.
So you're back volunteering, doing everything you love. I want to get to some of those questions from our viewers because those are coming in right now. We have a question from Becca. And Dr. Mosier, I'll direct this one to you. Are there other states that model the Care Collaborative?
That's a great question. We've had a few states that have reached out to learn a little bit more about our model. And I suspect, a couple are doing it in a little bit more of a regional manner, not statewide, kind of like our reach has become. So, yeah, there's some similarities out there. As we've learned about the value of connecting patients to the virtual monitoring and regular follow-ups with them virtually, and I see more and more of that being expanded out across a lot of private companies taking on some of that work as well. But I think that's a little different than our approach, which is to really develop that relationship with the patient, I think, that you've seen and observed with Janae and the Beckers.
Marie has a question for Margaret. Marie wants to know, what have you started doing differently cooking-wise since Vern joined the Care Collaborative? And she wants to know where you get your recipes.
Well, he's been diabetic a long time. So when I first started, I kind of cooked out, stopped, everything works together. And so I stopped using sugar in a lot of the recipes. And and I use, like when I make cornbread, I'll use stevia. And you can get a lot. And then I got a lot of diabetic recipe books. And a lot of time when he was diagnosed with having diabetes, there wasn't quite the, sugar substitutes that is fairly good and reliable back 10, 12 years ago. And then sometimes I'll punch in, he brought home a recipe like a crock pot dump cake. You cook in that has cherries in it. And luckily, I thought, well, I saw sugar-free or no sugar added cherries at Walmart, pie filling. And so a lot of it's just been experimentation. Will the stevia work in this recipe? And then I also try and, because he still has to have carbohydrates, like I check in with him what he's had for lunch. And if he's had a heavy carb lunch, then I won't have any carbs for supper. And yeah, go ahead.
Were you a coach in a former life or a teacher before this? You were very good at keeping people on task.
I was a teacher.
Okay.
I was a teacher.
I feel like Vern's like, yes, ma'am, I will do what you say. We have two more questions from the community. Janae, Laura wants to know, has your job always been virtual with your patients?
My job has, yes, been virtual because we serve so many different communities that, yes, it's been virtual, yes.
And then we have a question from Nick. Nick wants to know, Dr. Mosier, how do you protect the personal information with so much happening virtually with the Care Collaborative healthcare?
That's a good question.
Yeah, great question. Well, number one is, all of the virtual medical records and whatnot are in a HIPAA secured environment. So we're using very similar equipment and software as you would see within the practice of the medical office. So while it sounds like information is just flying around out there in the ether, it's still staying, within a software program, and again, it can't be shared across without patient permission, so there's a lot of collaboration. Obviously, that's in our name, and so all of our partners sign on and are part of our patient safety organization. That allows us to also, when they have a question about an approach or a process, or maybe something didn't quite go the way they expected, that we can go in and review, that care and make performance improvement recommendations and whatnot. So, yeah, everything still operates on all of the security of information and patient identification as it would in a physical office with paper charts.
For today's takeaways, as we wrap up this discussion, Vern, I want to start with you. If you had one message for people watching today, living in rural areas, with loved ones in rural areas, or if they're in rural areas, what would your message to them be?
Become a big part of your own health. Don't rely on one person to I know they keep me in line and everything, but I still say the doctors need some help too. If you don't take over the responsibility of not taking care of yourself, then I would say this program has got me to where I watch myself real close, and I don't know. I just seem to think, because the Care Collaborative, it's got me to the point where I'm more apt to take care of my own health than I am to just let it go and rely on somebody else. I feel like the doctors are overworked as it is, and I see them every day that I volunteer at the hospital, and I said, I've got to do everything I can to help that situation. And I think that's what Care Collaborative has done for me and the doctors that I work with.
Margaret, in all your years of teaching and being married to Vern, is Vern your best pupil ever? I mean, he takes notes.
That's kind of a loaded question. I sometimes get really bossy with him, and he'll just kind of go, and then do it anyway. So maybe.
Smart man. Happy wife, happy life, Vern. Anything you'd like to say, Margaret, to Vern's Care Collaborative team?
I just say thank you, because it's and if anybody has the opportunity to take control of, you have to take control of your own life, but it's also helped me as his partner see what I can do, evaluate what I can do to help that along. When we were first married, he promised me 75 years. And to do that, I've got to be a part of that, and we've got to work as a team to keep each other. And and Care Collaborative has helped that immensely. And I just want to say thank you. I don't think we would be this far along or this healthy in this stage if it wasn't for them.
And Janae, how do you respond to that as Vern's nurse who works with him regularly, virtually?
I mean, I think Vern is the picture. I mean, as you can attest, teamwork makes the dream work. I think it's amazing what Vern and everybody else has been able to do, and what we as a collaborative have done and continue to do to improve patient care and outcomes. I mean, it's like Vern says, we help him, we guide him, but he's the one that puts everything into play. So, yeah, I think it's just wonderful what Vern has done and how far he has come.
Dr. Mosier, must feel pretty good to see all your work come to fruition in such a shining example like Vern and Margaret.
Yeah, absolutely. It's kind of met what our original goals were. What could we do to improve the care? And that means supporting the providers out across rural Kansas, but particularly the patients. What could we do to improve their care, their lives? And that means, we can't always flood it with lots of dollars, or we can't find, 100 extra physicians or nurses, et cetera, to help with the workforce shortages. So technology is going to have to support that, and being able to do that as we move along this has been great.
Huge thank you to Dr. Mosier, Janae, and Vern and Margaret for taking the time to join us today. This has been a real pleasure. We've loved this discussion. And thank you to our viewers for joining the conversation. If you'd like to watch or share any one of our past episodes, just scan the QR code that's on your screen right now. It will take you to links of all of our past episodes. And we'll see you right back here tomorrow morning.
Coming up tomorrow on the Morning Medical Update, curing blood cancer thanks to family.
To have parents that have give your whole life and done everything for you, it's not even the discussion.
I'm Jessica Lovell on the next Morning Medical Update, the story behind one son's life-saving gift, Friday at 8.